Thank you, Rebecca, and good morning, everyone. The Department of Health thrives on providing all South Dakotans the latest updates on COVID-19 as it becomes available, and to that end, here are the latest statewide COVID-19 numbers. New confirmed cases, 166. New probable cases, 59. Active infections, 2,391. Recovered cases, 116,040. Currently hospitalized, 113. Total tests performed, 1,114,937. Total unique persons tested, 455,144, with 120,379 positive cases and 334,765 negative persons. We continue using the RT-PCR positivity rate since that measure is being used by the CDC as well as CMS for nursing home and long-term care facility reopening plans. And that last 7-day number as of this morning is 9.1%. Additionally, 508,407 doses have been administered to 306,642 state residents, translating to 51% of the state population having received at least one dose. All of this provisional data can be found on our COVID-19 dashboard found at doh.sd.gov. As a reminder, our next press briefing day will be held on Wednesday, April 28th. I will now turn it over to our state epidemiologist, Dr. Joshua Clayton.
All right. Thank you, Daniel. Just wanted to provide a few updates. We are seeing some additional COVID-19 cases across the state. Over the past week, and this is data from April 4th through the 10th, the full week, we've seen an average of about 224 cases per day, which is about a 20% increase compared to the 186 cases per day we saw from the previous week, March 28th through April 3rd. In addition, we have updated the number of variant virus cases that have been identified in the state. That information is found on the covid.sd.gov website on our dashboard. It's under the Tables tab. And you can see that for the B117 variant, we have identified 52 total cases. The B1351, we've identified a total of 1 case. And then the other 2 variants that have been identified are B1427 and 429, which were first identified in California, and we've identified a total of 9 cases between those 2 variant viruses. Some of the characteristics of individuals we've seen of those 62 variant viruses identified that we have 16 counties across the state where we have identified at least 1 case. While we do have that information on the website, the number of variant cases by county, it should be viewed as an indicator of the virus spread, as not all of the specimens are sequenced in South Dakota or in any other state in the nation. We do have at least 1 case of variant virus in every age group, ranging from the 0 to 9 year age group up to the 80 years and over population. The breakdown is roughly 50-50 in terms of female to male. It's actually 45 to 55%. The vast majority of those cases have been identified among individuals of white race, 85% versus 6% American Indian and 8% other and unknown. For the information on some of the vaccination side, I wanted to start with the update on the Johnson & Johnson vaccine that yesterday the FDA and CDC issued a recommendation to pause administration of the Johnson & Johnson vaccine out of an abundance of caution. No South Dakotans have been identified with the rare blood clot called cerebral venous sinus thrombosis. Nationally, over 6.8 million doses of the J&J vaccine have been administered, and currently there are 6 blood clot cases that have been identified. So this is a very rare event with less than 1 case per million doses.
Powerful and playful.
A further update on vaccine safety is just that despite the pause with the J&J vaccine, COVID-19 vaccines are safe and effective, and we continue to recommend vaccination for the U.S. And for South Dakotans. The adverse events can be reported by any person or medical provider by visiting vaers.org or vaers.org. And the data from that VAERS system have shown that the most common side effect is swelling, redness, and pain at the injection site, fever, headache, tiredness, muscle pain, chills, and nausea. There's also another system that's used for actively monitoring individuals called vSafe, and the program sends you text messages daily for the first week and then weekly for the several weeks after that. And this similar data have been identified in terms of overall side effects. The last thing I wanted to leave you with is that when we're looking at vaccination, South Dakota continues to be a vaccine leader among. When we look at the older population of those 65 years of age and older, South Dakotans have had a vaccine coverage estimate of about 87% versus 79% for the United States for a single dose or one dose coverage. For adults aged 18 years and older, we see South Dakota being around 53% versus 47% for one dose coverage in that 18 and over population. So with that, I will turn it over to Secretary of Health, Kim Nelson-Ryston.
Thank you, Dr. Clayton and Daniel. Good morning, and thank you all for joining us today. Before we open it up to questions, I just wanted to highlight a couple of things and reiterate a couple of things for y'all. So since our last briefing, we've seen over 508,000 South Dakotans receiving their COVID-19 vaccine, at least one of those, and that's almost 98,000 residents in a 2-week period. As Dr. Clayton mentioned, we remain a leader in and Johnson doses, and those will be held in storage while we're in this pause mode. While there's no shortage that currently exists, with the Pfizer and the Moderna vaccines currently being administered to people, really encourage folks to sign up and get in queue to receive their vaccine. Just as a reminder, the state's vaccine allocation does not include the supply that's being distributed directly from the federal government to the federal retail pharmacy locations across the state, to the federally qualified health centers, to the Indian Health Service, the Veterans Administration, or other directly supplied federal sources. As Daniel mentioned, about 51% of our state has received at least one dose, and over a third, 36% of the population, has been fully vaccinated. This remains critical because, again, vaccination is the quickest way out of this pandemic, and please help us get the message out that vaccines remain the main way to protect against hospitalizations and death, in particular from coronavirus. I want to also make a pitch that the 20 to 29-year-old population really take vaccination seriously. That is where we are seeing the largest number in total cases in recent weeks. And vaccination can help with that. It can also help with that population that is likely to spread, coronavirus to others. So please, if you're in that age group, get vaccinated because your health and well-being are important, and as is the health of others in our state. Relative to the Johnson & Johnson vaccine, as you know, the CDC and the FDA recommended a pause in the use of that particular vaccine after 6 very rare cases of blood clot were found in over 6 million people who had actually received that vaccine. This pause will allow time to prepare healthcare providers to recognize and diagnose patients, treat them appropriately, and report any cases that may be related to the vaccine. Again, 6.8 million doses of the Johnson & Johnson vaccine have been administered in the United States. Within South Dakota, we've seen less than 16,000 doses of J&J, about 15,744, and we've seen 0 adverse cases involving that vaccine here in South Dakota. Our number one priority remains the safety and health of all South Dakotans, and so We did, ask providers to pause on administering the J&J vaccine out of an abundance of caution. I also just want to share that if individuals in South Dakota have received the J&J vaccine more than a month ago, then the risk is very low to see any potential side effects. If you've received that vaccine in the last few weeks, people should be aware of these symptoms: severe headache, abdominal pain, leg pain, or shortness of breath within 3 weeks after vaccination. And so we would ask individuals with any of those symptoms to contact their healthcare provider or go to the emergency room or urgent care and make sure that their provider understands that they've received the J&J vaccine. To close, I want to stress and reiterate that no corners were cut when these vaccines were tested and put into production. It's really only been the bureaucratic red tape that's at the federal level that's been expedited, which is why we are having vaccines available to us at this time. So with that, I think we're ready to take questions.
Thank you, Madam Secretary and Dr. Clayton. At this time, we would like to open the floor for questions. If you could please identify yourself, your media outlet, and ask your question. Who would like to go first?
Eric Merritt, KELOLAND News.
Go ahead, Eric.
Yeah, my question is on contact tracing and what role it's still playing today and what role it'll have in the future. The Minnesota Department of Health sent that release about the contact tracing cases to that wrestling tournament in Sioux Falls. I was wondering if there's any threshold for the Department of Health to send out a notice of anything like that and what role contact tracing will play in the future with this pandemic. Thanks.
Well, Eric, thank you for that question. I would just tell you that we continue to do contact tracing here in South Dakota. That happens in a couple of different ways. We have an electronic survey that we ask folks to help us with completing that process and gathering information. And then we also have many staff that are dedicated to, also being part of that process. So I would just make the pitch that testing, contact tracing, monitoring hospital capacity, and now vaccinations remain really critical aspects of our overall response. And so we will continue to do that as long as we are experiencing this pandemic. The other thing I just want to address quickly, since you mentioned it, is the situation in Minnesota, and I think it's important to understand the larger dynamic there, where the state of Minnesota is seeing widespread transmission of COVID across the state. And so I think it's important that be kind of part of that context, and that it was really because Minnesota was closed to different activities that we saw people from Minnesota actually come to South Dakota to engage in that tournament. And, given the level of spread that was happening, we know that according to their information that people that attended that event, did experience COVID, but we also know that there is a lot of COVID happening in the state of Minnesota right now anyway.
Next question, please.
Yes, Todd Epp, Hello.com News.
I heard Todd Epp.
Thank you. I think this is probably most appropriate for Dr. Clayton. In looking at various statistics for South Dakota, and I guess, Josh, if you could help make sense of this, it looks like you can make any points you want to make about coronavirus and its spread or our efficacy in fighting it. Our vaccination rate is really good. Our spread rate doesn't seem to be very good. Other statistics are in the middle. You're the guy that deals with all these numbers. What are the most important numbers we should be looking at, and can you put those numbers in some sort of context of how we're doing against the coronavirus now a year plus into the fight?
So, I think, we can kind of talk about like overall numbers and so on, but, really what it comes down to, is what's going on, at this time. We know that there are people that are going to be continue to be at risk because they're either not in the window period after natural infection, have not received vaccination or are not taking additional precautions among both vaccinated and unvaccinated individuals. One of the key areas that we have always continued to focus on is hospitalization. And so if you look at what we're seeing, we have 113 individuals who are currently hospitalized. Now, some of the factors that we also want to look at that we see as early indicators for hospitalizations and deaths specifically are going to be the rate of cases, which we are seeing that increasing rate of cases, and our percent test positivity, which as of today sits at 9.6%. So it's not as ideal as we would like that to be. We are looking to be lower than 5%, and want to be able to have additional testing so that folks have access to tests, and we can identify those cases, which is really the key factor in why we look at that percent test positivity. But when we're looking at and when we talk about the overall impact of the pandemic, we'll be talking in terms of how well the health systems were able to handle the hospitalizations, what number of deaths that occurred, and the rate of cases and the percent test positivity play into that as early indicators.
All right, thank you.
Next question, please.
Yeah,
John
August Leader.
I heard August Leader.
Yeah, thank you. It would appear that new vaccine doses and unique individuals getting vaccinated are maybe starting to trend a little bit downward. I'm curious, are you guys, is demand sort of still outstripping supply, or are you seeing that demand is starting for vaccination and starting to soften a little bit?
Well, thank you, Jonathan, for that question. The situation that we're in right now is that we're seeing more allocation to the state, and so we've got a lot more opportunities for people to become vaccinated. I think we expected that demand would be higher with those older populations, and so what we've seen so far has been expected. But it's really important that we help younger people, in fact, understand the need and take the steps needed to become vaccinated. So we're kind of where we thought we would be, and needing to, really just help people understand that we've got safe, effective vaccine available, very convenient to get, not only through healthcare providers across the state, but lots of pharmacy locations. Indian Health Service has, done a great job of getting vaccines out in their communities, and so, we feel good about the ability to access vaccines across the state.
Next.
Jeremy Fugleberg, Foreign News Service.
Go ahead, Jeremy.
Yeah, HHS put out a map of survey results for vaccine hesitancy, and I'm not sure if you're aware of that map and those results. If so, I'd be interested for your comment on that. But if not, what it shows is a pretty serious swath of central South Dakota into southwest South Dakota, with counties where they identified particularly high vaccine hesitancy, around 30%. Is that something that the department is looking at addressing specifically in terms of populations that may or may not be more vaccine hesitant, and trying to encourage vaccine uptake among those people?
Yeah, absolutely, Jeremy. And so, if I had to describe our approach at a very kind of macro level, we knew that the allocation of the vaccine itself would not meet initial demand. So we wanted to, get to the point where we could get, that allocation up to a point where we had enough for all the folks that were looking to become vaccinated early on, but recognize that there would be people that would need more information and more time, and maybe different kinds of outreach to become vaccinated. So we are actively working towards that right now with folks who, now that we've got more access available, to the degree that there is more information needed for them to become vaccinated, those are some of the strategies that we're working on right now, and that will be very specific to different populations, and there's a lot of different ways to kind of look at that, but definitely that will be the work that we're doing in the coming.
Next question, please.
This is Jerry at WNAX.
Right?
Go ahead, Jerry.
So of the people hospitalized, since that's been trending upwards a little bit, is there any tracking of those that are now hospitalized, have had vaccinations, and any statistical significance to that?
So, you know, we do have a monitoring in place for individuals that have fully completed their vaccine series, and whether that's one dose with the J&J vaccine or 2 doses with the Pfizer and Moderna vaccine. The number of individuals that we've identified with what is considered that breakthrough disease is 117 South Dakotans. Now, the vast majority of those individuals, you know, have not developed a severe enough disease to require hospitalization. So I think that's a key point that I want to make, in that, you know, those individuals have not gone on to develop, you know, more severe infection. But specifically to hospitalization, we have had 15 of those 117 that did require hospitalization. So, you know, when we look at what we would expect for cases of breakthrough infection, you know, that would be you know, as many as 5% of all of the individuals who have been vaccinated. You know, not everybody is, again, exposed on a regular basis and has the potential to go on to you know, develop infection and is challenged in that way. But the 117 number of 117 individuals is well below you know, what we could potentially see with a vaccine with an effectiveness of 95%.
And a quick follow-up, have you seen anybody with the second infection, the second COVID go-round?
So, yeah, we have seen a number of individuals, we consider them as possible reinfections. The reason that we consider them possible reinfections is that we do not have oftentimes the specimen to be able to look at their first and their subsequent infections to see if it is truly a different virus, and to do that genomic sequencing. Most of the laboratories in the state, as well as the commercial laboratories out of state that are used, discard samples within about 5 days, which makes that sort of tracking very difficult. But throughout 2020, we have had 118 individuals with a possible reinfection.
I believe our next question is from Ray.
Yes, can you hear me?
Yes, ma'am.
A few weeks ago or months ago, the DOH made a big push for volunteers to help with vaccination. What's the status of that? Have you used those volunteers, or what's happening?
Thank you, Ray, for asking that. And so, yeah, we had a great response to our request for volunteers really across the state. And so what we did with that information is shared it with our Phase 1 vaccinators so that as they are working to vaccinate people in communities across the state, they have that list of individuals to pull from. So we got that information out to those folks that are providing vaccines, and at last count, that was over 3,500 individuals. And so they, you know, are continuing to rely on those volunteers in certain communities in particular. I can tell you that at the site here in Pierre, there's a number of volunteers to help you check in, get you to, you know, point you in the right direction to, you know, to fill out the information and get your vaccine. So I know that they're being used, you know, at sites throughout the state.
I had another question, if I could. You mentioned that the COVID was widespread in Minnesota. At the time those folks came to the wrestling tournament, youth wrestling tournament in Sioux Falls. I'm just wondering, if we know that it's widespread in a neighboring state, is it a good idea to basically invite folks from those states into South Dakota when we appear to be doing so much better? I mean, isn't there a risk of spread here?
So, Ray, I don't believe that this was a Minnesota tournament that just happened to be held in South Dakota. So they weren't invited by, South Dakota or the state of South Dakota. And so they were all Minnesota participants.
I know technically they weren't invited, but we're sure advertising or suggesting that we're open to events like this as a state. So basically that's not a technical invitation, but it just seems like we're saying, come on in because we're open and we know that you have widespread COVID.
Yeah, and again, I mean, those are decisions that, we're going to continue to provide good information, the most recent information, and, people have to make decisions that are best for them about participating in events, and, that happens, that needs to happen for people in other states as well.
We have time for one more we have time for one more question. Can I have the last question, please?
Eric, may I take it?
Go ahead.
I was just going to ask about what else people should know about these variant cases, how they're identified and what they mean. I know it says it should be considered an indicator of wider transmission. If you could just kind of describe what exactly that means and what people should know about the variants.
Yeah, and so that is a great question. The type of surveillance that we're doing to help monitor the identification of variants in the state is called sentinel surveillance. And that means that we take a certain proportion of all of the positive specimens, and that helps us identify whether there is the presence of these virus variants within the state. So it's used as an indicator of wider transmission because there is not the infrastructure across any laboratory in the United States to sequence all of the positive specimens that are received, and so we look at a specific subset of all of those positive COVID-19 tests and try and identify, what is circulating. And so at this point, the vast majority of those variants that have been identified have been the B117, which we do know, the impact is that it has about 50% greater transmission, which means that it's going to be a little bit faster at spreading throughout the community, and that there is potential for that virus to cause greater hospitalization and death, and so that is one of the reasons why we do the surveillance to identify variants in the state.
And with that, we would like to thank you for